So let's go right into dentistry standards. So a few things we're going to cover. So certainly personnel, so PPE for dental procedures and kind of some areas of opportunity within the standards. Also the environment and just some ideas for reducing that contamination that happens within dentistry. And then a little bit of instrument care towards the end as well. So just to ask, I am pretty sure I know the answer for each of you, but I just want to be sure, does your practice perform any non-anesthetic dental cleanings?
Heck no.
Oh, I love it. Thank you, thank you. No, I appreciate the enthusiasm there. So good. That is one of our rule outs, if you will. So if the practice does perform any non-anesthetic dental cleanings, they are not able to be AHA accredited. Because that is required for dentistries. So we'll go straight into a mandatory standard because we've talked about it a little bit, but it's been a while. So all dental procedures are performed under general anesthesia with patients intubated and supplemental oxygen being administered. Very straightforward. So a little bit of this was covered in the introductions, but the PPE that your team wears when performing dentistries, it sounds like most often your mask and your caps. So DE 4.1 is practice team members performing and or assisting with dental procedures where mask, eye protection, and gloves, caps, and lab coats, gowns, or separate scrubs that are not worn in other areas of the practice or for other patient-related activities. So for dentistry specifically, we're just talking about dentals, mask, eye protection, and gloves, of course. And even, having one of those the masks that have the shield as well that covers the eyes, that is great. As long as people wear it appropriately, it works well. The caps and the lab coats or gowns, you can use like a used lab coat just to kind of cover your garments that are underneath during that procedure to be sure you're not carrying other things in parts of the hospital. Some places will have a lab coat that they'll put in the area in the morning before you start dentistries, and then that's what you put on or around you when you're doing that procedure. That's just for the day. Then you clean it in the evening and start over with a fresh one the next day. So you have a lab coat or a gown or something that you're wearing while you're doing the dentistry procedure. And then caps, definitely something just because it is, surgical. It protects your head. It protects everything in your hair, and you certainly don't want whatever bacteria could be in these mouths to also end up in your head and your scalp, because that does happen. So having a cap on just helps with that, just cleanliness and general hygiene. But there are some nasty bugs that love to be in hair roots and start in the mouth of a patient where it's nice and warm, and there's a lot of good things that they can eat and grow. So any questions about this one?
So just to be clear, this is required that they have to wear caps and gowns?
It is not required.
Okay.
No.
Okay.
Yep.
Because I think it'll be a struggle.
Yeah.
I still struggle with getting them to wear the eye protection sometimes. So.
Oof. I have some really good pictures I can share with you that hopefully help them. Because if you see some of the infections that could occur, and there's, been a lot of cases where these bacteria, they're just really super bugs at this point, and you can't cure them. And I don't think anybody wants that. So let me know if you need those pictures. I'll be happy to send them your way.
Send them to all of us, because I bet they would be very helpful. I'm sure we all have the resistant people. So.
That's right. All right. Definitely will do anything to help. It's hard to create new behaviors, and it certainly takes time. And, really what we do every day is coming to help other things like our pets. And so when we kind of turn that on us and say, how can we help ourselves better? It's just really difficult for whatever reason to do that best, So it takes time. I definitely understand the frustration, and keep at it. You'll get there. Persistence plays off.